Hello, I'm Dr. Hashrul Rashid and I'm currently based in Melbourne, Australia. I am a cardiologist based at Monash Health and also a clinical adjunct lecturer at Monash University where I teach cardiology. I am also completing my PhD thesis, which examines the role of CT imaging in transcatheter heart valves. I've had the wonderful opportunity over the last 5 years to be actively involved in TCT Asia Pacific and a few other conferences by CVRF such as complex PCI and AP valves. And one of the most striking experience I have was my first presentation in TCT Asia Pacific in 2016, where I had the daunting experience of presenting in front of esteemed cardiologists. I had Ted Feldman and Philippe Generoux to moderate my paper, and I was very fortunate to have been awarded the best abstract for structural intervention for a topic of my PhD thesis. I've thoroughly enjoyed my experience at TCT Asia Pacific over the last 5 years. And one of the things that I really enjoyed the most was actually to attend the complex PCI and also the complication sessions, where I find that it's a very learning-full experience to be able to see quite complex cases and complications that you don't regularly see, and sharing ideas amongst the participants about how they would manage these problems. And these case sharing experiences are really helpful for my training as a cardiologist. Now, overall, I find that all the CVRF events are run extremely well. The moderators to participants and also the organizers have been extremely great. People are extremely friendly, and I find that I have a lot of great memories and experiences from all these sessions. I found that Seoul was a beautiful city, and where the TCT Asia Pacific is run at the COEX Mall is an extremely strategic location located in the middle of the city and also next to a large shopping complex. I really enjoyed my experience in Seoul. I find that the city is vibrant, it's full of culture, and I extremely enjoyed the food, something that I grew to love throughout my experiences at TCT Asia Pacific. I loved it so much that I brought my family over for the TCT Asia Pacific in 2019, and we had a wonderful experience looking at all the wonderful historical buildings, enjoying the great food, and also just being immersed in the wonderful culture that Korea has. And I would definitely look forward to be going there in person again in the future. So throughout my medical training, I've always gravitated towards the field of cardiology because I find that it has a wonderful mix of procedural skills, clinical science, and the art of medicine, the art of talking to patients and establishing good relationships with them. It's a unique specialty where you get to manage patients who are acutely unwell and also be able to be part of their care in the chronic and long-term phase to ensure that they make better decisions in their life and also better care and giving them better care as well. I find that it's also a specialty that's highly innovative, that is dynamic, and there are a lot of new research that's going on to ultimately improve how we can deliver patient care to our patients with cardiovascular disease. And I find that this is one of the reasons why I've always been attracted to this specialty, and I'm extremely grateful to be an interventional cardiologist in this era. In the next phase of my career, I am fortunate to be able to travel to the UK to complete a postdoctoral fellowship at Guy's and St Thomas in London, where I'll be completing a clinical fellowship in structural intervention and structural CT imaging under the guidance of Professor Bernard Prendergast, Professor Simon Redwood, and Professor Ronak Rajani. And I'm hoping to learn all the aspects of structural intervention And I'll also be completing a research fellowship here as well with collaborators in the King's College London, where I'll be furthering my experience and research in the field of leaflet thrombosis post-TAVI. And it's something that I'm extremely looking forward to. And I hope I'll come back as a complete cardiologist and being able to establish myself as a researcher in the realm of interventional cardiology.